My camera does not want me to record this video. This is my third time recording this video. It better be the last time. Anyways, hey everyone. Promised I would make a video about my consultation appointment. So here it is. Before I start making this video, I'm gonna have two disclaimers. First one is that even though I've had my consultation appointment, it does not mean I have a surgery date set. I have no idea when that's going to be because my insurance still hasn't pulled through, and frankly, it could be a year from now, it could be longer, it could be less. I have no idea. And I know, like, especially at this point, I should technically have a surgery date. That's what the consultation appointment is. You go in, have that, and then they say, okay, when do you want to have your surgery? Not my case. Second disclaimer, I'm going to talk a lot about my man boobs in this video. So if people do not want to hear anything about that, I will let you know when that time is about to happen. And yeah, normally I would not be comfortable talking about that on the internet, but also I figure that it will help people out, anyone who's looking to get top surgery in the future, and I'd rather help people out than be shy. So yeah. So yesterday I had my consultation appointment. It's with Dr. McGinn. The unique thing about her is that she's a trans woman, which doesn't happen, in my experience at least, very often. Like, any surgeons that I've seen are cis people, you know? And that's fine, that's totally fine. It's really cool of them to do trans surgeries. But when I was researching, I saw McGinn, and I saw that she was a trans woman, and I figured, you know, she understands. I feel like going with her might be a really good idea. And I'm so glad that I went with that, and I'll describe that a little bit better later on. Anyway, she's in Pennsylvania for anyone who is in the United States and kind of looking for surgeons. I went to the consultation appointment. It was really cool because the area that she has, like, it's not a place with a bunch of surgeons, it's literally just her place. And it's very trans friendly. I go in, McGinn walks in, and she, you know, introduces herself, that kind of thing. She's like, alright, so let's... Well, first she asked me what kind of surgery I'm looking for. I mean, she knows top surgery, but she was like, do you want keyhole or double incision? And I said, well, keyhole. I'm pretty damn sure I'm eligible for it. And she said, okay, well, I actually don't do keyhole very often, just because not many people are eligible for it. And she said, it's not something that I would be opposed to doing, I just haven't done it very often. And I said, okay, cool. So she said, alright, let's see what's going on. So I take off my shirt and binder. So this is the time for the second disclaimer. If you don't want to hear about my man boobs, stop watching, please. Thank you. And the first thing that she says to me is, you know, you have a third nipple. You know that, right? And I was like, what? I thought she was joking. I thought she was joking at first, because I had no idea. Apparently I have a third nipple. I have this little spot, kind of like on the top part of my ribs, and my entire life I thought it was a mole, or just some odd scar mark thing, or whatever. No, it's a third nipple. So that was something new that I learned about my body. So then, you know, she looks at me and she says, well, you definitely are eligible for keyhole. You do not have a lot going on at all. You could do that, however, and this is what I very much appreciate her for, because she said, you know, most surgeons would tell you, well, you're eligible for keyhole, go for it, because not many people are, and that way you don't have the scars going on. And she said, yeah, while I normally would say that, there are some things that I think would benefit you better if you went for double incision. How my man boobs work is, like, I don't have a lot going on. They're, like, a little bit lower than where they should be. So she looked at my nipples and was like, alright, so your left nipple is a little bit lower than your right one, and it's also a little bit bigger. Mind you, my nipples aren't very big. They could pass as large-ish male nipples, but, like, they'd still be fine. And then she said, well, we can change those so that they're a little bit smaller and more of the size that you would want. And I said, okay, cool, I'm game for that. But she said, you know, we can't do that if you do keyhole. If it's keyhole, your nipples will remain exactly the same size. Double incision, we can kind of do whatever we want with them. And then she said, yeah, we'd have to move your left one up a little bit, and then actually both of them up kind of where your pec muscles would, just where it would fit better with your pec muscles. And then she said, yeah, your pec muscles are really great for a trans guy, and frankly, even as this guy. And I was like, well, thank you, going to the gym's been paying off. So that was nice. And she also was like, you know, technically you could probably just walk around on the beach and no one would question you. Like, your voice is low enough and you pass and all that kind of stuff. And I said, well, thank you. I very much take that as a compliment. But I don't have anywhere near the confidence to be able to go shirtless without having surgery. Like, there's still work that has to be done. Essentially what she told me is that, like, she wouldn't be able to kind of make those edits too much and, like, just move everything around to where it's supposed to be unless it was double incision. So I was like, alright, you know, that makes a lot of sense. And then she also said, and I don't remember the exact terminology, but with keyhole, if you gain weight, then it looks weird. Like, you'll have fat, and then a little indent where your nipple kind of goes in, because the fat was taken around that. Or, I don't remember exactly what it was, but she said something along the lines of that, and she said, okay, so with double incision, you wouldn't really have that much problem. Although, that being said, there aren't many people that come back 10 years later to show their results. That kind of thing. So she said, there's not a lot of knowledge about the kind of long-term effect of it, but with double incision you would have a better time with aging than you would with keyhole. So with all that she said, I was like, okay, you know, I actually think that I'm going to go with double incision. Which is really weird, because she said, any other surgeon would be like, McGinn's fucking crazy, go for the keyhole because you can, because you don't need the scars. And she said, like, they can call me crazy if they want, but this is what I think personally would be best for you. Like, she wants to do this surgery the best way that she can for me, so that I can be happy. If she thinks that double incision will be better for me than keyhole, then I think so too. That was a little bit different, because, you know, I've gone through pretty much the entire time thinking I'm gonna have keyhole, and I don't think so at this point. And she said, you know, just think about it. Like, you don't need to decide today. Frankly, you can call me up a week before the surgery and be like, yo, I want to do this one. So she's giving me lots of time to think about it. She said, like, I want you to look at more pictures and really think about it, and look at pictures of older trans guys and see what surgeries they've had and stuff like that. And she did a lot of drawing on my body, actually, with a pen, of like where everything would be after surgeries and stuff, and like where my pec muscles were and where my nipples should be compared to that. If someone really wants to see that picture, I did take a picture of it, of like where my man boobs are at now and where they would be after surgery and all that kind of thing. So just let me know, I'll send it to you. It's not something that I'm going to want to post into a video publicly, because obviously it would be me shirtless, but for science, for research, I would be willing to do it, so let me know. But yeah. So that was how the consultation appointment went. It went really well. She's fantastic. I would recommend her to anyone. If you want someone who's going to be very honest with you, then I would suggest going to her. Not that other surgeons aren't, but she will, like, I think that, like, she knows what she's talking about. Yeah, if anyone has any questions about the consultation appointment, let me know. I'll answer them. And that's pretty much it. I'll talk to you guys later.